Choose your prehab exercises dependent on your pain and available range of movement. Regular cycling and walking is a good plan if you are able. Alright guys, I'm going to run you through a straight leg raise. Giles had his right leg operated upon. I'm going to ask him to put his right toes so they point towards the ceiling. I'm going to ask Giles to squeeze his quadriceps muscles nice and tight. We're going to lift the whole leg as a unit up around 30 centimetres, holding for about 3, 2, 1, slowly back down, and then let the leg relax. I'm going to repeat once more. The toes are going up towards the ceiling, preempting a contraction with the quadriceps, good squeeze of the muscles, lifting the leg up as a whole unit, round about 30 centimetres, hold 3, 2, 1, back down, let the leg relax, and that's a repetition done. Hi guys, I'm going to introduce you to static quads. Giles had his right leg operated upon. In order to get the blood flow moving into the legs, get the muscles activated, we're going to ask him to do repeated contractions of the quadriceps. I'm going to say, Giles, can you find these muscles and squeeze the quadriceps, straighten the leg as hard as you can, holding it for 3 seconds, 2 seconds, 1 second, and relax. We're going to repeat again. I'm going to say, can you squeeze those quadriceps, try and get the leg straight, hold for 3 seconds, 2 seconds, 1 second, and relax. That's 1 repetition. Hey everyone, I'm going to introduce you to a bridge. I'm going to ask Giles, who's our model, both knees bent up for me, Giles, round about 90 degrees of a bend, feet slightly apart, roughly hip width apart. It's fantastic, and keep the gap in between the knees as well. In order to do the bridge, I'm going to say, Giles, can I get you to squeeze your bottom muscles and lift your bottom up off the bed for me, right the way so we're absolutely flat line between the shoulders and the knees. Hold there for 3 seconds, 2 seconds, 1 second, slowly back down. Okay, we're going to repeat the same movement. So I'm going to say, Giles, can you squeeze your bottom muscles? Can you lift your pelvis up off the bed? We're aiming for this flat line between the hip and the knee. It gets the tummy muscles working, the bottom muscles working, and it generates strength and balance through the hips and pelvis. Slowly back down. Thank you, Giles. And we will repeat 3 sets of 10 repetitions in order to get the muscles working. Hi guys, I'm going to introduce you to mini squats. I'm going to ask Giles to bend his knees slightly, stick his bottom out slightly, keep his torso up nice and tall, and we're bending so far as the knees cover the end of your toes. So down into a mini squat for me, Giles, perfect, and back up again. Mini squat again, and back up again. I'm going to ask Giles to turn 90 degrees so he's facing away from me. So as he's going down into a mini squat, we're sticking our bottom out slightly, we're keeping our torso nice and straight, and back up again. And bending once more for me, Giles. You can see the knee is only just covering the toes, we're not going too far, and back up again. This is great to get the early stages of getting the gluteals working, the quadriceps working, get the muscles pumping and the circulation going. Hi everyone, I'm going to introduce you to a one-leg stand. Giles has a left sided issue. It's either a left hip that needs operating or it's a left hip that has been operated upon. We're going to practice standing upon that leg. I'm going to ask Giles to transfer his weight onto the left-hand side, staying nice and upright, not moving the torso one way or the other in order to keep his balance, but rather use the leg musculature to keep his balance. And relax the other side back down for me, Giles. Once again, onto that left-hand side. We're going to hold this position for 5 to 10 seconds to get those muscles working and thinking about balancing and taking the weight through this side. So hold for another 3, 2, 1, and relaxing back down. We're aiming for around about a minute of exercise, 10 seconds on, 10 seconds off. So that is 3 sets of 10 seconds. Hi guys, I'm going to introduce you to a standing hip flexion exercise. Giles' right side is being affected, so what he's going to do is he's going to have the weight on the left hand side, but he's also going to use the support of the back of a chair or something very solid in his right hand so that if he doesn't feel unstable at any time. So I'm going to say, Giles, can you lift your knee forward and the foot up off the ground? We're going as far as we're comfortable going. Once we reach the point of tightness or stiffness or stop point, we hold it there for a few seconds and then we lower the leg back down again. Going to repeat again, so we're lifting the knee upwards, foot up off the ground, we're bending at the front of the hip, holding that position, couple of seconds, foot back down towards the ground. Make sure you're balanced, make sure you're steady. It's not a strengthening exercise, it's an exercise to encourage movement into the front of the hip. Hi guys, I'm going to show you a standing hip extension exercise. So Giles had his left leg operated on, or he has a painful left hip that he wants to get moving. He's going to stand holding the back of a chair. It could be a table, anything that's solid that gives you a nice support for your hands is what you're going to be holding on to. I'm going to ask Giles to lift his heel backwards and upwards so that the leg is coming back. You can slightly bend at the knee. You do not have to keep your leg straight. Holding that position, 3, 2, 1, and bring the leg back down to resting position. We're going to repeat again. The weight's on the good side. The bad leg is being pushed backwards, holding it in the air. 3, 2, 1. Slowly back down, back to standing position. We're aiming for about 3 sets of 10 of these to try and get the gluteal muscles working, try and get a stretch into the front of the hip, try and get some blood flow coming around the hip area. Hi guys, I'm going to show you a standing leg abduction exercise. Giles has had his left leg operated upon, or has a problem in his left leg. So what he's going to do is he's going to use both hands on a solid support. We're using the back of a chair. You could use a kitchen worktop, a table. As long as it doesn't move and is safe, you can use whatever you like. I'm going to ask Giles to put his weight through the good side, the non-operated side, and the non-painful side, which is his right side, and take the left leg out to the side, keeping it dead straight. As far as we're happy going, hold that position. 3, 2, 1, slowly back down. We're going to repeat, keeping the legs straight, out to the side. 3, 2, 1, slowly back to resting position. There are your repetitions. We're going to aim for 3 sets of 10. Get the muscles on the side of the hip working. Try and get them energized and some blood flow around the hip area.